Hello everyone, I'm Dr. Elena Vance and this is a medical moment. Today, we're talking about the #1 killer of adults in America, heart disease.
Heart disease principally refers to coronary artery, atherosclerotic disease. We'll refer to this as CAD. Coronary artery disease is the long-term, progressive occlusion or blockage of the coronary arteries. The coronary arteries are those that supply blood to the actual heart muscle. Those prone to coronary artery disease usually have arterial disease elsewhere and are the usual cause of strokes or occlusion of arteries that supply blood to the brain. Heart disease develops slowly over years and, if the individual is lucky, causes recognizable symptoms before causing a fatal heart attack or disabling stroke. Common symptoms include, but are not limited to, chest pain, especially with exertion. The pain may spread to the left arm and hand. Shortness of breath, especially with exertion and/or when accompanied by chest discomfort or a feeling of pressure in the chest. Awakening from sleep with shortness of breath, especially if the person has to sit or stand up to breath. Chest palpitations or irregular heartbeats, and a feeling of the heart flopping around in the chest. All these and more are indications to be seen by a physician as soon as possible. Given the commonality of CAD, we should point out those factors that put you at risk. Over the past decades, it has become clear that certain features pose an increased risk of CAD. Here are the 5 most important and independent risk factors. A family history of early and severe heart disease. That is a bad genetic history. The tendency to heart disease can be inherited, but we're not talking about granddad dying of heart problems at age 86. A bad, inherited genetic predisposition is usually manifested by serious heart problems before age 50. Other risk factors include diabetes mellitus, cigarette smoking, high blood pressure, and high cholesterol. Certainly, there are other compounding factors such as sedentary lifestyle, obesity, male gender, and others, but these alone do not pose a statistically significant risk alone. There is little or nothing that can be done about a bad family history, except early, by age 35, and often evaluation by a physician. Diabetes can be managed, and with new techniques of monitoring blood sugar, the complications of diabetes, including vascular and heart disease, can be significantly reduced. The single easiest way to avoid any number of very serious medical problems, including heart disease, is do not start or stop smoking. Within 24 hours of smoking cessation, the risks imposed by smoking go down. Patients with heart problem must not smoke. High blood pressure or hypertension can usually be controlled with medication, which significantly reduces the risk of CAD. Finally, reducing otherwise high blood cholesterol, especially the low-density fraction, or LDL, is associated with risk reduction. This can be accomplished with proper diet and medication. The level of cholesterol that is acceptable is best determined by your physician or cardiologist. In future videos, we will discuss more ways to improve your health well-being. If you found this video helpful, hit the subscribe button and we'll keep you posted. Stay healthy.